As the human movement exams for my third semester is coming close, I'm getting more and more nervous by the day. And one of the most important thing for us students of human movements is to learn the human musculoskeletal system, because we are going to talk about the movement of the muscles so much. I'm going to do a quick, and I'm going to see how quickly, if I can, cover most of the major muscles that you want to know as a human movement student. And here we go, or as any person generally, if you're doing movement of any kind, dancing, pushing weights, gymnastics, you should know all these things. So here we go. We begin with the seems to be everyone's favorite muscle, and this is this one. And also, learning these names is also like learning a new language. Can you see this from this muscle here? Okay, that's the sternocleidomastoid. It originates here in the sternum and the clavicle, and it attaches or inserts at the mastoid. That's the first big neck muscle. Second big neck muscle I'm going to talk about is this one. Can you see this muscle? It is originating here in the lower jaw and inserting in the clavicle all over like that. And that's called the platysma, like because it's flat. Okay, just posterior to the sternocleidomastoid, we have the scalenes, and there's actually three scalenes: anterior, mid, and posterior. Just posterior to the scalenes is what we have, the levator, that allows us to lift our scapulae. So that again attaches from the back of your head, the capitis, and it goes all the way to your, what we call as the shoulder plates, right? Or scapula. Levator scapula or levator scapulae. I'll have to check what is the right word. But that covers the primary, the most. There are some more smaller rectus and oblique muscles just behind the head. We are not going to cover that so much right now. Okay, having done that, let us look at quickly the back. So, yeah, you can see that. That's my scapulae that's moving. That's not a muscle, but the scapulae is a part of what we call as the shoulder girdle muscle. And there are four important muscles in the shoulder girdle. So this spinous thing is this bone over here. Everyone can feel it. There's a protrusion over here. It's called the spine of the scapula. And just superior to that spine is what we call as the supraspinatus. Very easy. Okay, and then inferior to that spine, we've got the infraspinatus. All right, and just under the infraspinatus, there's one muscle going over here which attaches again to the humerus. That's the teres minor. And that's the third muscle of the shoulder girdle. And the fourth one, which is under the scapula, like a submarine, like a subscapularis. So these are the four muscles of the shoulder girdle. But hey, the main thing, shoulder itself, well, that's called the deltoid. Well, I hardly have it. Well, maybe, yeah, that's the deltoid. And the deltoid is roughly like a triangular shaped muscle. And, well, it can also be anterior, lateral, and posterior, mid and posterior deltoids. Okay, so since we're already covering the back, the two huge muscles at the back, the first one, which is really one of the large muscles, it originates along the spine all the way to the cervical spine. All right, and it goes like this. And then it attaches somewhere in the thorax. And that's like a trapezoid, like a kite. and that's why it's called the trapezius, or the traps like we call it. After the trapezius, the next big muscle which originates here near the iliac crest, and it goes all the way up like this and attaches to the humerus. That is called the, yeah, it's one of the big muscles, one of the large muscles of the body, and that's the latissimus dorsi. I even like the name. It's quite a mouthful, and it's very, yeah, it's nice. Latissimus dorsi. That's the big one. Now, our ability to keep our spine straight, back straight, that's because of I don't want to put a number, but there's muscles that help us keep our spine erect. So let's go for it. There's one running right along the center, and it goes like around here. That's called the spinatus. That's number one. Then, if this is a spinatus, there is some muscles which are going slightly at an angle, and those are called the supraspinatus. All right. Other than that, there's this one long muscle riding all the way here and attaching right up here, and that's called the longissimus, because it's really long. Longissimus capitis, because it attaches to the cap, your head, your copy. All right. And then we, even more lateral to that, or outside that, we have the iliocostal muscle, which is again pretty long. All are a part of what is called the erector spinae. And that's primarily the big muscles of the back. And now let's start of the posterior back, all right? And, there's, under the trapezoids, there is the rhomboids. The rhomboids, the big one and the small one, major and minor. We also may talking about major and minor muscles. There is one little assistant to our latissimus dorsi, which attaches from the inferior end of the scapula into the humerus, and that's called the teres major. Teres minor is a part of the shoulder girdle, but the teres major is not. All right, that really does, I think, covers all the back muscles. Now, looking at the forward, we've got a few very important ones. Let's try to cover them ASAP, as soon as possible. Wow, it's already approaching 7 minutes. Here we've got the big chest muscle, and that's called the pectoralis major, pec major. And under the pec, there is, so the pec major has origins from the sternum, and all of it then attaches here in the humerus. So it allows us to do such kind of motion, adduct our arms, and push and punch, all out of that. Under that, we have the pectoralis minor, and they kind of go slightly upwards like that, and they're under the pec major. Okay, that's the chest muscles. And if we go inferior to that, under very deep, we have a muscle which is something like this, and it works like that. And that's, if you've guessed it, yeah, it's the diaphragm. We don't get to see that. All right, now we come to the abdominal region of the body. And obviously, this, everybody knows this, the abs. It's called, because it's a straight muscle, it's called rectus abdominis. All right, and then there is this huge muscle that originates like this and wraps us all around. Since it wraps like obliquely, and it is external, it's called the external oblique. And starting from the back, there's muscles, again, oblique muscles, which are coming in like this. Those are the internal obliques, obliquus internus abdominis. And then you have the muscles which go transverse, which are the transverse abdominis. And these are the muscles of the front thorax. Now, also there's the intercostal muscles, which are the ones connecting the ribs or between the ribs, between the costi. Since we are okay, I think we will not cover the lower body and the limbs right now. This is good for a 10-minute. Wow, I didn't know it was going to take me 10 minutes, but let's take a quick break over here. Thank you very much. I think I didn't do so bad, but I think I made a few mistakes. Let me know where or which they were. But, well, homework over for me.